At Prisma Health Richland, we strive for excellence in patient care, serving a diverse range of patients. We are a level 1 trauma center, a level 3 neonatal ICU. We're an advanced comprehensive stroke center and also serve complex patients with disease states such as durable left ventricular assist devices, ECMO, and also pulmonary hypertension with prostacyclin management. So the PGY2 critical care program, it offers 9 core months that are already pre-planned for required rotations. That includes an orientation month and a research project month. In addition to that, you'll have 7 core months of required rotations. Beyond that, you'll have 3 months that you're able to choose from elective opportunities in a variety of areas that are robust experiences. You'll have longitudinal projects, both a research project and medication use evaluation. And there's also a variety of what we call flex items that have to be completed throughout the year. Pending resident interest and what their previous experiences are, we're really able to tailor that to them to be able to provide opportunities for manuscript writing, peer review, drug monograph review. There's a variety of options that can help meet those flex item requirements.
So our residents, basically starting off the year, we try to build a really solid foundation in pediatric knowledge. And so they start off through our general peds rotation, and then they move on to either critical care, infectious diseases. We have a long list of learning experiences that we offer, and so it's a large variety that they can choose from. We provide our residents with a supportive and progressive academic environment. And this allows our residents to learn the clinical skills needed to provide optimal care to pediatric patients.
Our ID PGY2 program really has some really neat aspects to it. We aim to train folks really across a broad aspect of infectious diseases, inpatient and outpatient ID. That includes both consults and stewardship. They can learn system-wide and patient-level management of infectious diseases. We have a large component of HIV and global health where they can actually experience things even outside the US. The resident really has a number of things that they experience. One, they're going to come into an environment that is very interprofessional. And I think a lot of places will say that, but we truly live it here. Our Infectious Disease Pharmacy Residency program coincides with our ID Medical Fellowship program, and they really grow up together, as we say. Many times they're here for 2 years with us as a PGY1 and then a PGY2, and when they do that, they build those relationships. Very few places have infectious disease physicians who are really embedded into our training. There's a lot of cross-training that happens. So they're learning it from the pharmacy side, but also the medical side as well, which I think is incredible rewarding for those folks that get to participate in that. They get both the inpatient and the outpatient aspects, which means that when they go to practice, they'll have each of those experiences will help them match what their career aspirations are.
I did pharmacy school in North Carolina. I'm originally from Pennsylvania, and I really just fell in love with the Carolinas. So I was trying to stick in the area of the Carolinas. When I came to Columbia, I really enjoyed the atmosphere. There's always something going on at the college, and we've just had a lot of fun going to different sporting events, hanging out at different local restaurants and breweries, things like that. And then it's nice all year round, so you can get out, walk, do all kinds of things for most of the year.
So I actually went to school at the College of Pharmacy in Columbia, and I did a lot of rotations here as well as other places in the area. But one thing about Prisma that really stood out to me is that they're a family here. And so it was really nice to not only feel like I was learning, but also be supported in other avenues as well. I worked here as a pharmacy intern in the outpatient pharmacy, and so got to make a lot of connections there and have just continued to grow on those connections moving into the inpatient side as well.
It was really the people and the culture of the pharmacy when I was interviewing at different places where I felt like I fit the most at Prisma. It was really refreshing to hear how many people stayed or have come back to get jobs here, and I really thought that that just spoke to the culture of the program.
I think a resident experience in this program is a challenge while also getting to have fun and enjoy your year. We have a lot of really great preceptors who have a lot of great experience in their area of expertise. And so I think you kind of get a lot of different areas like heart failure, internal medicine, critical care, even down to like MICU, STICU, all those kinds of things. So you get a really diverse experience here, with the best people that could probably teach you. And so it is challenging. However, we have a really good time and we've all made friends with our co-residents, and so it makes the year really fun.
And so past residents going on to practice in pediatric critical care, hematology oncology, infectious diseases, cardiology, emergency medicine, general pediatrics, the list goes on and on. And this is either in the Southeast, Northeast, and Midwest.
The majority of residents that leave our PGY2 critical care program do go into clinical practice. That has been in a variety of places, whether that be critical care or emergency medicine. We've also seen some of our past residents shift into other roles, including academia and administration. That's been one of the most fun parts for me as an RPD, is to be able to follow and stay in touch with those who have left the program, still have that relationship, and also to be able to interact within professional organizations and such moving forward.
We've had folks that have gone into HIV management. We've had folks that have gone into strictly an inpatient infectious disease consult management, and some that work in stewardship networks where they're working maybe over a system as opposed to a particular patient level. So it's been really fun to see these graduates over the years explore so many different career opportunities.
I feel very good about next steps. I'm very interested in staying in the area, and everyone has been very supportive in helping me find a role that will allow me to do that.
I think I've been set up for success because when I go to apply for jobs, this kind of makes me an ideal candidate for anything people may be looking for, because I've had a little experience in everything. I also think that Prisma is a big name within the state of South Carolina, and so I think just having a good, robust program coming from, I think that also helps prepare me for the future.